Hello, welcome again to the Well Woman podcast with me, Dr. Frances Pitzilis. This podcast is designed for general educational purposes and does not replace your consultation with your healthcare professional. Today, I want to talk about what I regard as my bugbears about hormone therapy in women, especially that I think progesterone is not being prescribed enough. After years of studying and learning and all my clinical experience, I still remark about the lack of use of progesterone in women in all the ages that I see. The youngest woman that I've had to give progesterone was 20, and I still prescribe it for elderly women because it helps them sleep, it reduces anxiety, it helps the brain, and you'll find out a little bit more in a minute. As a result of this concern of mine, I wrote a whole book about progesterone, which I didn't publish because I put some of this information into my best-selling book, Well Woman. So what is progesterone? Well, like all the sex hormones, it's made in the body from cholesterol. 80% or so from the adrenal glands, 20% or so from the ovaries. But when you're pregnant, the placenta makes it and your brain also makes it. I will give you links to two of my videos in the description. One of them is all about progesterone and the other one is about estrogen dominance, which is where there's not enough progesterone in the second half of the cycle that influences the anxiety, depression, migraines, irritable bowel, breast tenderness, heavy and painful periods that women get because they're starting to lose their progesterone in the second half of their cycle. And this is one of the reasons that I think women are not getting it enough. Now, during the course of my research, I looked at topical, which means rubbing it into your skin versus taking it by mouth. And I found no research about using it as a cream. But that doesn't mean that it may not be helpful because many of my patients have used it as a cream and have told me it has helped them. But I think there are two important areas where the oral progesterone is a good idea, and that is that it's much better for sleep and anxiety taken orally. And we know that orally, possibly around 300 milligrams, is what helps to protect the woman from breast cancer. And that's in the research. So the next thing I want to mention is the interesting time I had when I researched this book. And I found that even some of the researchers could not distinguish themselves in their minds about micronized natural progesterone versus synthetic progestins. They got them mixed up and they started saying that natural progesterone was going to give you the side effects of synthetic progestins, which is wrong. And so, unfortunately, I think that the data sheet that talks about the drug company micronized progesterone that you can get has got the wrong information in it because they've taken that information from data for synthetic progestin data. And so they're going to say that it causes blood clot and depression and other problems, but that's not true. It's the opposite. So I wanted to let you know about that and that you need to be quite critical when you're listening to some of the information and you need to wonder whether this person has really got it right. I find that even some of my specialist colleagues haven't quite got that right either. So where did all of this come from? Well, it comes from where hormone replacement therapy came from. And in fact, we now call it menopausal replacement therapy. And I remember in the 80s when I was a family doctor that we were already prescribing a synthetic progestin, one that was actually relatively safe, and synthetic ethinyl estradiol. And if you'd had a hysterectomy, the theory was that you didn't need progesterone. And this was taken from the fact that before my time in the 80s, doctors were prescribing estrogen to give relief to the hot flushes, but then the women that were just taking the estrogen who had a uterus would bleed. So they remembered what they'd learned in relation to the contraceptive pill and added in a synthetic progestin, which is what they had at the time, to stabilize the lining of the uterus. So that's why, if you've had a hysterectomy, the current attitude is that you don't need any progesterone. So that was the case during the 80s. And then we had a product that combined oral horse's urine estrogen and a progestin called Provera. That was the brand name. It's still around now. It's used as a contraceptive injection called Depo-Provera. Its actual name is medroxyprogesterone. And so leading up to 2002, there was a large study called the Women's Health Initiative Study. And this was run by nurses. The average age was 63 in the women. And it was done for a drug company called Wyeth at the time. And they had 3 parts to the study. They had placebo, which means they took a non-medicine. They had women who still had a uterus, and they had the horse's urine estrogen and the synthetic progestin. And then if you'd had a uterus, or you didn't have a uterus, you were only given the horse's urine estrogen. Now, both of these groups got stronger bones and less bowel cancer. However, this group that had the synthetic progestin ended up with a higher risk of breast cancer. So the study was stopped early at 5 years instead of at 8 years. And so at that time, it was all over the papers. HRT causes breast cancer. So this is why I think that doctors shied away from it and started to worry about it, and general practitioners lost confidence to prescribe it. And I think this can still be the case today. Now, what are the benefits of progesterone? It promotes brain health by protecting the brain and nerves, and it increases myelin around the nerves. That's the insulation. And so in that case, it can help with multiple sclerosis. It helps symptoms of menopause early as the woman approaches menopause before the periods stop, because on its own, it can reduce hot flushes and help sleep and anxiety. We know that natural progesterone is not associated with the risk of blood clots, and it actually protects the heart because it stabilizes the electrical signals in the heart, reducing abnormal heart rhythms and sudden deaths. It dilates blood vessels, and it can improve levels of the good HDL cholesterol when taken with estrogen. It can be associated with reduced breast cancer, and it reduces blood pressure and fluid retention. And in some cancers, it has been helpful, including endometrial cancer, melanoma, and mesothelioma. It reduces depression and anxiety, which I've already mentioned. And of course, I came across the research in the fertility research, whereby it improves the fertility because it's supporting the second half of the cycle, where the progesterone helps to implant the fertilized egg into the lining of the uterus. It's also been found to reduce infant risk of respiratory distress syndrome and low birth weight babies, and it prevents spontaneous miscarriage and preterm labor. Now, here are the areas where I don't think doctors are using it enough. Women with polycystic ovarian syndrome could do very well with progesterone because they're often prescribed the contraceptive pill, but what if they want to conceive? They're given metformin if the doctor knows that this is an insulin-resistant problem. But they're often not given progesterone when I see them. And progesterone lowers blood sugar, increases metabolism, reduces fluid retention, and helps weight loss. It also helps acne and hairiness along with zinc. Now, the way that that works is that patients with polycystic ovarian syndrome have a bit more testosterone, and that testosterone can convert to dihydrotestosterone by an enzyme called 5-alpha reductase. And that 5-alpha reductase is blocked by progesterone and zinc. So that's why polycystic ovarian syndrome patients can do much better if they're taking progesterone. Now, what about endometriosis? Well, one of the things that's going on in endometriosis, apart from the inflammation and the other things that are going on, is that the tissues are progesterone resistant. They're resisting the action of progesterone. And remember that both polycystic ovarian and endometriosis can be associated with an underactive thyroid, and progesterone helps the thyroid and the metabolism. So you really need more progesterone than the woman has when the woman has got endometriosis. And of course, she has a higher risk of breast cancer as well. So the progesterone would help with that. Now, another area is approaching menopause. What I've noticed is that family doctors, as soon as the patient says, I've got a hot flush, they give them estrogen and progesterone. Well, if their periods haven't stopped, and if they're early in the course of their menopause, that we call that the transition, the menopausal transition, they only need progesterone. On its own, progesterone can start to reduce those hot flushes. Now, as the ovaries approach and go through menopause, they start losing progesterone first, then estrogen, and then testosterone. So it's not unusual for me to see patients who have been given estrogen and progesterone, and they either don't get better or they get worse, because the estrogen is going to make them worse, particularly if they've got heavy or painful periods. The estrogen will make those worse, and it will make their anxiety and depression worse if they haven't got enough progesterone to balance things up. So that leads us to premenstrual syndrome and heavy or painful periods. And I do refer to these in the videos below. You don't need Prozac if you've got premenstrual syndrome. You need to correct all your vitamin and mineral deficiencies like vitamin D, magnesium, zinc, B vitamins, etc. And you need progesterone, because what's happening is that premenstrual syndrome starts to occur in women after 35 and as they approach menopause. This is the same for heavy painful periods. They don't necessarily need a Mirena, which is the IUD that has some progesterone on the shank. Now, what I understand about the Mirena is that it gives the woman the equivalent of 2 mini pills a week. But remember, it's synthetic estrogen. It's not, it's synthetic progestin. It's not the same as natural progesterone. And I've even come across women whose doctors have said, you're on HRT, here's the estrogen, and because you've got a Mirena, that's okay, you don't need progesterone. And I don't think that that's safe enough for the woman. I think it's better, and she'll get more benefits by having progesterone as well as that Mirena. So we've gone over, if the woman's had a hysterectomy, we've gone over most of my bugbears about where it's not being used enough. But in addition to that, I think that the dose is not given high enough. The starting dose is 100 milligrams, and that's what it says on the data sheet. But I use up to 400 milligrams, and in some of my patients, I can go up to 500 or 600 milligrams with very difficult cases. So women shouldn't be worried about the dose of progesterone. And remember that the doctors are still learning about all of this. Now, so be confident to ask, or could I try a bit more? Now, that now leads me to the different types of progesterone. In New Zealand, we didn't have Utrogestan, which is a brand of progesterone, until 2.5 or 3 years ago. And until that time, I had to prescribe micronized progesterone, which is made in a certain way to be able to act and work for a period of time only, and women had to pay for it and buy it from a compounding pharmacy. Now, what I've found is that seems to be the best tolerated progesterone. However, about 90% of my patients tolerate the Utrogestan very well. The small percentage that don't tolerate it are women who have a tendency to be sensitive to food, sensitive to drugs, and have allergy problems or autoimmune problems. So just be aware of that. So when you think about these situations, remember to ask if progesterone can be useful or if the progesterone dose can be increased. It's pretty safe unless the patient has breast cancer or a gynecological cancer. And remember, even without a uterus, it's okay because it helps the woman sleep, reduces anxiety, and reduces hot flushes. So thank you for listening and watching. Remember that this podcast is for general educational purposes and does not replace personalised healthcare advice. Thanks for coming to the Well Woman podcast. Please like, subscribe, and share this with anyone you think could be interested. And I'll see you at the next one. Bye for now.